Types of veins in the leg. One's superficial, the other is deep and could be life-threatening if there's a problem there that is left untreated. Today we're actually going to tell you what you need to know about DVT or deep vein thrombosis and also tell you how to prevent it. Dr. Deborah Manjoney is with the Wisconsin Vein Center and MediSpa. Good morning to you.
Good morning.
Nice to have you here. And March is actually DVT Awareness Month.
That's right. That's right. And last year, you know, it was really in the limelight because I think Serena Williams had her DVT, and it just happened to be about this time of year, right around the time of the Academy Awards. And so people were really talking about it a lot more, but it's not something we should forget.
Yeah.
DVT does affect 2 million people a year.
It does.
Yes.
2 million.
Yeah.
What is it? If somebody recognizes it and it's treated early, what is the symptom or what is it they notice that leads them to seek help?
Usually they have discomfort in their leg and swelling.
Is it always in the leg, or can it be other places? No, it can be in other places in the body, but then it's not usually able to be determined. You know, somebody doesn't have the symptoms necessarily. DVT is deep vein thrombosis, and thrombosis is clot formation. Now, a clot forms in the body all the time. Anytime you bruise yourself, you may get a little clot forming in a blood vessel, but it gets washed out because it's in balance in your blood. Okay.
Blood's meant to flow, but if the blood is slowed down for whatever reason, then a clot can develop and actually can overcome all the declotting mechanisms that your body has naturally.
And it's potentially life-threatening when what happens?
Right.
It breaks off and goes to the lung?
That's exactly right.
Okay.
So that's the usual way that it can be life-threatening. There are some other things. But what happens is the veins are the blood vessels that are returning the blood to the heart and lungs, and so the blood flow is into the heart.
Okay.
And so the veins, if they have a clot in it that breaks off, goes right into the heart, and then can lodge in an artery going into the lung and block it off.
One of the things I think is important as it relates to this is pretty much everybody's at risk because there are so many risk factors: pregnancy, obesity, cancer, different medications, prolonged sitting, prolonged hospital stays, immobility, smoking.
Birth control pills are huge factors. In and of themselves, they're not necessarily a big risk if you don't have a family history of clotting. But if, for instance, if a woman takes a birth control pill and is a smoker, her risk is increased over 30 times what a normal person, what an otherwise healthy person is.
How many times?
Over 30 times.
Wow. If you are a smoker and you're taking birth control pills,
you are at high risk.
Really high
for getting
risk.
Clots.
Okay.
Yes.
So one of the ways to prevent it then is to stop smoking.
That's right. That's right.
Or maybe consider not taking birth control if you can't kick the habit.
That's exactly right. But then there are other forms of immobility of any kind. So if you're sitting for long periods of time in a car, on a plane especially, you're at risk to develop clots in your legs because the blood is not flowing. You're preventing the blood from flowing because when you get up and move around and your muscles contract in your legs, you're really pumping that blood. So if you're sitting, it's not happening. Now, these are pictures of people who actually have superficial phlebitis. The blood can clot even in those varicose veins or superficial veins that aren't underneath the muscle. So it's not usually considered to be a life-threatening problem. However, when people have superficial phlebitis, there is now known to be an incidence of 40% of people have a concurrent or at the same time have a problem in their deep vein with deep vein clot.
Okay,
and that has been missed for years and years and years.
Okay, so let's repeat that because you just used a word that I asked you what it means during the commercial break, and there might be a lot of people who don't know what that means.
Phlebitis is an inflammation in a vein, and usually when we see a phlebitis, it means the superficial vein that's closer to the skin gets inflamed. The reason it gets inflamed is because it has a clot in it. So one or the other started the problem, but you get them together. You get a thrombophlebitis, a clot, and a vein that's inflamed.
So, and what you just said is important, and that is that if you notice that concurrently or at the same time,
you still need to see a doctor because there's a 40% chance you have a deep vein clot going on at the same time, which can be life-threatening.
So it might look superficial, it might truly be superficial.
But there can also be an associated deep vein clot, which could be missed. And the other thing is if you have varicose veins, so you have a bigger vein, the blood flow automatically is slowed down.
Okay.
And so any injury to that vein, when a clot forms as a natural response to injury, is going to potentially propagate or get bigger and bigger and bigger. And if it does, the valves are already destroyed, and so the entrance into the deep vein doesn't have a safety valve to prevent the blood clot from going into the deep vein. And so it can get into that system and go back to the heart.
Important that March is DVT Awareness Month. So let's just really quickly say what the bottom line is here, and that is?
The bottom line is if you're going to be immobile for any length of time, you need to be thinking about getting up, moving around, doing some exercises to get some muscles contracting in your legs so you don't develop a clot. If you happen to have risk factors in your family, or you're obese, or your birth control pills and smoking and the other things we've talked about, see if you can modify your lifestyle, because it is important to know. But if you get pain in your leg and swelling and you don't know what it is, you really do need to seek medical attention. So that
right away.
People can, yes, so that you can have an evaluation with an ultrasound, a totally benign and painless procedure to look at the imaging and see if there's a problem with the deep vein clot.
Important information. Thank you so much for sharing it with us. You can find out more, have your veins looked at if you visit the Wisconsin Vein Center and MediSpa. Don't wait, call today. The phone number 262-746-9088. You're located in Pewaukee on Georgetown Drive. You can also go to wimedispa.com for more information. Thank you so much.
Thank you.